Okay, so doctors, we are talking about this s- colon cancer screening. So, as we discussed that the colorectal cancer screening start from the 45 to till 74 year. So, screening start from basically from the age of 45 till 74. So, we have three category: category 1, category 2, and category 3. So, category 1, like there is average population. Okay, no risk factor present, no family history, nothing. But these patients only first degree relative diagnosed with the age greater than 60 years. So this patient belong to category 1. No risk factor. After 60, the diagnosis of colorectal cancer, it means the category 1. So what about the category 2? So category 2, there is the diagnosis before the age of 60. So cancer diagnosed before the age of 60 year of the age. Okay. Are second condition, one first degree and one or more second degree relative with colorectal cancer diagnosed at any age. Okay, so this can also lead toward second degree. And third condition, two first degree relative with colorectal cancer diagnosed at any age. So this belong to also in category 2. So different, any different situation come in exam. So that's why these three different point you have to memorize. So easy. If before 60, simple, it is a moderate risk. Or second condition, if one first degree and one second degree at any age. So this is also moderate risk. And the third condition, two first degree relative at any age. First degree mean the patient brother, sister, father, mother, right? And what about the second degree mean the patient like aunt, uncle, like that. Okay. So what about the category 3? Doctors, it is extremely important, so please be focused. So category 3, any individual should be advised that the risk of developing colorectal cancer is at least 4 times higher than the average, but could up to 20 times higher than the average. Okay, if the following feature will be present. So which are the following feature? For example, the two first degree relative and second degree with colorectal cancer at least diagnosed before the age of 50. So here is the age cutoff is 50 year. So before the age of 50, two first degree and one second degree diagnosed before the age of 50. It means the patient belong to category 3. Okay. Second condition, two first degree and two or more second degree relative with colorectal cancer diagnosed at any age. So here is the two first degree and two. At any age, the patient belong to category 3. Okay. So third condition, three or more first degree relative with colorectal cancer at any age. So this is high risk, category 3. Okay. So the important one, next important. So for moderate, for category 1, so you have to go for the screening test like immunochemical fecal occult blood testing. Every 2 yearly is recommended starting at the age of 45 year, counting to till 74 year of the age. Okay, every 2 yearly. So this is important. What about the colonoscopy? Is not generally recommended in screening age group at slightly higher. Okay, so in category 1, the FOBT every 2 yearly starting from 45 year, okay, to till 74 year, every 2 yearly. But what about the category 2, which is moderate increased risk? So you should have to start the colonoscopy should be offered 5 yearly starting at 10 year younger than the earliest age of diagnosis of the colorectal cancer in first degree, or the age from the 50, whichever is earlier. So it means in case of moderate category, you have to start the colonoscopy 10 years before their first degree di- patient diagnosed with cancer. So colonoscopy every 5 yearly. Okay. So for example, the patient, her father diagnosed at the age of 60. So you have to start the colonoscopy from the 50 year of the age in patient. Okay. So, and colonoscopy every 5 yearly. So what about the category 3? So category 3, high risk, for people at potential high risk of colorectal cancer where Lynch syndrome has been excluded. So you have to start the colonoscopy should be offered every 5 yearly, starting at 10 years younger than the earliest stage of the diagnosis of the colorectal cancer in first relative or the age 40 or whichever is earlier. So it means you have to start the colonoscopy before 10 year. For example, here patient diagnosed with the 50 at 50 year of age. Okay. So you have to start the screening at 40 year of their any relative, their son, daughter, or any other. Okay. So 10 year earlier, whichever. For example, patient diagnosed with at the age of 35. So you have to start the colonoscopy at 25. Or same if the patient diagnosed at 45, you have to start the 10th year earlier at 35. And colonoscopy every 5 years. Doctor, does it make sense? I know I have, first time it is hard to uh, contain, but I hope so. The important things right now you to understand what we are talking. So after that, if you give a read in your own time, this will make sense. Doctor, is it okay? Are you with me? Yes, it is making sense. Okay, doctors. So the important things you just need to know. Nothing need to do the extra things. So the things we discuss is enough. Okay. Okay, I will go through the again in summary, so don't worry. Okay, don't worry. So aspirin is chemoprotective. Trial of calcium, some vitamin supplements, selenium or statin have provided mixed evidence of benefit. So the strong evidence of the benefits has emerged from the observation study to exposure on non-steroidal anti-inflammatory drugs. So some evidence about the aspirin use. Okay. So the summary. Let me show you the one thing. Recording will be available. Yes, doctors, you have to access this website. So just give write the colorectal cancer screening, Red Book 10th edition, RCGP, you will find out. And few of the paid guideline. So we provide in the form of PDF as well. So this is the summary. Uh, okay, doctor, this is the handmade written notes. So I think this is all over the summary. So I think these things make sense to you. Okay. So, okay, doctors. So category 1. So category 1, it means, as we discussed, average risk population, no family history, one first degree relative diagnosed a greater than a diagnosed at the age greater than 60 years. So it means there is talking about the average population. So what about this clinic recommendation? You have to go for FOBT every 2 years from started from the 45 to till 74. Okay, simple. What about the category 2? So category 2. In category 2, the first degree relative diagnosed before the age of 60. Okay, or one first degree or one second degree at any age, as we discussed from the guideline. Okay, our third condition, two first degree at any age. So this belong to category 2. So colonoscopy every 5 yearly, or you can go with the 10 year before the first degree relative diagnosis. Started from the age 50 to till 74. Okay. So basically colonoscopy here starting from the age of the 50. What about the category 3? So category 3, two first degree relative, okay, or one second degree relative before the age of 50. first condition. Second, two first degree or two second degree at any age. Okay. Third condition, three first degree at any age. So this belong to category 3. So in this patient, you have to go for colonoscopy every 5 yearly. You have to start the screening before 10 year. Okay. You can go with the 40 to 74 because patient diagnosed from the age of 50. So start colonoscopy 40 year. So let's suppose patient diagnosed with colon cancer, their first degree at 45 year of age. Okay. So you have to start the colonoscopy at 35 year. Okay. 10 year earlier, when whichever the age. Okay. 10 year earlier. Make sense, doctors? Uh, Let me see the chat box. Doctor, don't worry. I will share the handbook. Don't worry. So the things we discuss make sense. And Dr. iPhone and other all doctors. So this is extremely important. So that's why Dr. iPhone. Doctors, please write your name so it is easy for me to call. So doctors, this topic is extremely important. So please go through, and I think makes sense now, right? No need to repeat again. Okay, doctor, should we move to next question? Yes. Okay. Okay, next question. 16-year-old girl, food stuck in throat for 6 to 12 duration, was on PPI but not settled. Endoscopy, white exudate, loss, vascular pattern. What is the next step? So option A, topical steroid, fluticasone or oral budesonide. Option B is continue PPI. So doctor, what is the diagnosis here? Doctor, focus on this food stuck in throat as well. So food stuck in which condition? And was on PPI but not settled. So this is also important. Yes, Dr. iPhone thinking in a smart way. So this is the actually case of the eosinophilic esophagitis. Okay, so PPI already patient used, but no effect. Okay, and we use the PPI in case of esophagitis as a trial for 8 weeks. So here is the diagnosis. So PPI used for 8 weeks as a trial. So if no effect, then we have to go for the endoscopy. So in our case, the patient already done with the endoscopy and already uh, uh, done with the trial of PPI. So straightforward, we have to go for the treatment. So we will go with the fluticasone or oral budesonide. So fluticasone we can go topical as well, inhaler. So let we discuss with the help of RSCGP guideline. So let me show you. Just a second. Okay, doctor. So this is from RSCGP. So as eosinophilic esophagitis is chronic inflammatory condition of esophagus that leads to the esophageal dysfunction and symptom including dysphagia and heartburn. Okay. So this is overall. So no need to go for pathogenesis. So what are the clinical feature? So the clinical feature of eosinophilic esophagitis differ depend upon the patient age group. So children are likely to present with the difficult feeding, failure to thrive, or vomiting. Okay. Adolescent and adult generally complain of difficulty swallow or food infection. So, like in our case, the problem in the food stuck in the throat. So, food infection is the one of the major complaints in case of eosinophilic esophagitis. Other symptoms including heartburn, dyspepsia, chest pain, and many patients come to attention after undergoing the acid suppression therapy, GERD. So, sometimes there is a misdiagnosed considering as a GERD, so that's why they take the PPI as well, but no effect. So which result is minimum improvement in their symptom. What are the investigations? So this is the specific diagnostic criteria, including all. So symptom related to the esophageal dysfunction, greater than 15 eosinophilic on esophageal biopsy, and persistent of eosinophilia after the PPI inhibitor trial. So you have to use this PPI for 8 weeks, but there is a no improvement or minimal. So this is also help to make the diagnosis. And after that, there is you have to go for the biopsy endoscopy, and here you can see that there is a eosinophilia. Okay, so this is the causes. Eosinophilic esophagitis, GERD, PPI, eclasia, Crohn disease, parasitic infection, drug allergy. So just give read. Okay. So here is important thing. Diagnose require persistent esophageal eosinophilia following a course of the PPI treatment. Okay. So course of PPI is required to make the diagnosis. PPI treatment for 8 weeks as per the guideline. Okay. Preceding the diagnosis of the eosinophilic esophagitis. Too important to distinguish between the true or GERD. Okay. So this line is important. So 8 week of trial, you have to go for PPI to make the diagnosis. And after that, many patients undergo the immediate upper GI endoscopy prior to the commencement of the PPI trial because of dysphagia is the alarming symptom for cancer. So repeat endoscopy following the completion of PPI treatment. So this is also extremely important. So after the complete the treatment trial of PPI, after 8 weeks, you have to again undergo the endoscopy. Okay. So repeat endoscopy after that. So you have to focus on the question what are the conditions. So if ask about the next step, so next step you have to go for the PPI trial to make the diagnosis. Okay. So what about the treatment? So basically treatment of EOS consists of dietary, pharmacological, endoscopical intervention. There is a no Australian guideline for the management of eosinophilic esophagitis. In many cases, treatment decisions are empiric and use of pharmacotherapy off-label. So dietary modification basically first line treatment. So remember this. After that, you have to go for this pharmacotherapy as well. So in pharmacotherapy, medical management is necessary in patients who do not respond to dietary measure alone. Okay. Topical glucocorticoid, namely fluticasone and budesonide, as we discussed, are currently regarded as the initial therapy of the choice. So this is the important one. So you just need to know only this. Okay. So name fluticasone or budesonide as an initial therapy. Okay. So this is the off-label use of these preparation Australian fluticasone. Fluticasone is delivered via the MDI without spacer. And these drugs should be sprayed into the mouth, and patient should be instructed to swallow the contents with 5 ml of water instead of inhaling. So budesonide is available at the liquid suspension, usually for the nebulization, but eosinophilic esophagitis, this viscous slurry should be delivered by the swelling. Okay, so the things treatment part you have to go for fluticasone and budesonide. Make sense, doctors? Okay, I think enough discussion on that. So move to next. Okay, doctors. So the things we discussed. Just here is a reference. Okay, next question. Alcoholic father died at 42 years due to the cirrhosis. Son developed ataxia at 40 years. Next best. Option A is serum copper. Option B is serum seroplasminogen. Option C is liver biopsy. Option D is MRI. Option E is CT brain. So what is the diagnosis here, doctors? Doctor, what is the diagnosis? What do you think? Yes, Wilson disease. So this is the case of Wilson disease. Okay. So in Wilson disease, the initial step you have to go for the serum seroplasminogen. Okay. So you can see that there is a typical presentation in the eye. There is the Kayer Fleischer rings. Okay. Sorry. So so you can see the ring-like structure. So this is the clear Fleischer rings around the eye. So the initial step, you have to go for the seroplasminogen to make the diagnosis as an initial. If this is ineffective, the best after that to make the diagnosis as a confirmatory, you have to go for liver biopsy. Okay, to confirmatory. Another serum copper, urine copper excretion. These tests are not too much reliable. So the initial one, this thing you just need to know, and this is the gold standard. Okay. So KS Fleischer rings, these rings plus typical motor neurological abnormality are decreased the seroplasminogen in nearly pathognomic for Wilson disease. Rarely these rings occur in other liver disorder, biliary primary biliary cirrhosis as well, but seroplasmin level should be unaffected. So basically seroplasmin level is affected in case of Wilson disease. Okay. Because in this case the copper accumulation in the body, because they are retaining here, so that's why it lead to the different conditions, like it can lead toward there is acute liver failure, cirrhosis, hepatitis as well, then neurological finding like dysarthria, dystonia as well, or maybe lead towards the tremor. So this is the basic presentation. So let me show you a guideline. Just wait. Okay, doctor. So this is the guideline. So okay. So Wilson disease, also known as progressive hepato anticular degeneration, result in the accumulation of copper in the liver and other organs. Okay. So hepatic or neurological symptom develop. So diagnosis is based on the low serum seroplasmin level and high urine excretion of copper and some other liver biopsy result. So in almost half of the patient, particularly adolescent, the first symptom is hepatitis, acute, chronic, or active, or fulminant. But hepatitis may develop anytime. So approximately 40% of patients, particularly young adults, the first symptom reflect central nervous system involvement. Okay. So central nervous system combination of lead the patient can go the most common and including any combination of tremor, dystonia, dysarthria, dysphagia, cordia, drooling, incoordination, and CNS may be manifest as cognitive or psychiatric abnormalities. Okay, so it lead toward like affect the multiple system. So you can see the eye structure is deposition of the TF Fleischer rings. So diagnose slit lamp examination for Keyer Fleischer rings level of seroplasmin. So that's why we have to go for the seroplasmin. Okay, so this is, but confirmation test is by the with the help of liver biopsy. Okay, doctor. So only these things you just need to know. Okay, doctor. Should we move to next? I think. So doctors, again, one more question on show the question. Question, Dr. Saab, you can see here. So alcoholic father died at 42 years due to the cirrhosis. Son developed ataxia and 40-year next best. So in next best, they are talking next best. So you have to go for the serum seroplasmin. Clear? No. Always, where is the next best? It means they are talking about the at the spot. What are the situation demanding? So next best step, whatever you find where the word is attached next. So next is mean there is initial test. Okay. If asked about the most appropriate best diagnostic, it means that they are talking about the confirmatory. But where is the word next? For example, next best, okay, or next appropriate, okay, or uh, where the word is the next. So it is means talking about the initial step. So initial, not diagnostic. So next step, like in some question, you will find out next most appropriate. So don't confuse that that they mention about the most appropriate. So we will go with the best test. No. So in that case, the next most appropriate you have to go for the initial one according to situation. Okay. So where is the word next? So it means there is a not confirmatory, not definitive, but just initial step. So if there is the most appropriate, okay. So most appropriate are what is the best test, what is the confirmatory test, not the word attached with the next. So you have to go for the best one, diagnostic gold standard. Okay. Make sense, doctors? Very simple. Where is the next word? It means initial. Okay. Yes. So that's why this is the only which I give you the trick where the word is next. So this is not the definitive. Simple. Other test most appropriate, best, confirmatory. So the gold standard diagnostic. So this is the gold standard. This is the best test. Like this. Easy. Okay, so this is also question from the colorectal cancer at 42 years, maternal lung cancer at 40 years. What is the next best step? So 42 year. What is the answer, guys? We already discussed these topics and this topic takes too much time. So what is the answer? Yes. So you have to go for the colonoscopy at 32 year of age. Well done, doctors. Okay, doctors. That's all about for today's session. So I hope so this session is uh, having a benefit for you. So I think the things make sense for you. A lot of, I think, new topics we discuss today for you. So the things make sense for you. Thank you, Dr. Udnan. Thank you very much. Thank you, Dr. Emily. Inshallah, next one tomorrow is the Sunday, so enjoy weekend. I will announce, inshallah. So, doctor, this is the random question. Whichever the gynae, medicine, surgery, any randomly call, we will discuss this topic as well. Like today is about decreased fetal movement, like this. So that's why. Thank you, Dr. Zishan. Okay, doctors, then